Medical nanotechnology, revolutionizing drug delivery to the urinary tract. Nanoscale drug delivery systems offer a remarkable opportunity to precisely target specific cells or tissues within the urinary tract. Researchers have been exploring various strategies to design multifunctional nanocarriers capable of carrying therapeutics and exhibiting specific targeting properties. Drug-loaded nanocarriers can be engineered to respond to specific stimuli, such as pH, temperature, or enzyme activity, allowing for controlled drug release at the desired location. Additionally, surface modifications can enhance the targeting ability of nanocarriers, ensuring site-specific delivery and minimizing off-target effects. The integration of different functionalities into a single nanocarrier system presents a promising approach to optimize drug delivery and enhance therapeutic outcomes. Bladder cancer is a prevailing condition that poses significant challenges in terms of diagnosis and treatment. Nanoparticles have emerged as valuable tools in the battle against this disease. By encapsulating chemotherapeutic drugs within nanoparticles, researchers have been able to achieve improved drug solubility, prolonged circulation time, and enhanced tumor targeting. Additionally, nanoparticles can bypass efflux pumps and overcome multi-drug resistance, making them valuable assets in combating drug-resistant bladder cancer. Furthermore, the exquisite surface properties of nanoparticles can be exploited to attach targeting ligands, antibodies, or peptides, facilitating selective accumulation and internalization within tumor cells. The use of nanoparticles in bladder cancer treatment shows great promise for enhancing therapeutic efficacy and reducing systemic toxicity. The urinary tract is lined with a protective layer of mucus, which acts as a barrier against invading pathogens and foreign substances. However, this mucus layer also poses challenges to the effective delivery of therapeutic agents. Nanoscale drug delivery strategies have been devised to overcome these mucus barriers and ensure efficient drug transport. Surface modifications of nanoparticles with mucoadhesive polymers can enhance their residence time and facilitate penetration through the mucus layer. Moreover, the use of stimuli-responsive systems can trigger changes in the physicochemical properties of nanocarriers, allowing them to transit through the mucus barrier and deliver drugs to the underlying tissues. Overcoming mucus barriers holds immense potential for improving the efficacy of drug delivery systems in the urinary tract. Urinary tract infections, UTIs, are a common ailment affecting millions of individuals worldwide. Developing effective treatments for UTIs is crucial in combating pathogenic bacteria and preventing severe complications. Intravaginal nanosystems offer an innovative approach to address this challenge. By formulating nanocarriers suitable for intravaginal administration, researchers have been able to enhance drug retention in the vaginal mucosa and target pathogens within the urinary tract. These nanosystems can encapsulate antimicrobial agents, ensuring sustained release and prolonged therapeutic action against bacteria. Furthermore, engineered nanoparticles can bypass the biological barriers, such as the vaginal epithelium, and directly reach the underlying tissues. Intravaginal nanosystems represent a promising avenue for the treatment of UTIs, providing precise drug localization and reducing the risk of systemic side effects. Achieving localized and controlled drug release within the bladder is a significant challenge in the field of urinary tract therapeutics. Stimuli-responsive nanogels have emerged as an innovative platform to address this challenge. Nanogels are hydrogel-based nanoparticles that can swell or shrink in response to environmental signals, such as pH, temperature, or enzyme activity. By encapsulating drugs within these nanogels, researchers can achieve precise and on-demand drug release within the bladder. The stimuli-responsive nature of nanogels allows for the release of drugs triggered by specific physiological conditions or bioactive signals within the bladder. This approach maximizes drug efficacy, reduces systemic exposure, and minimizes side effects associated with conventional drug delivery systems. Stimuli-responsive nanogels present a promising avenue for enhancing drug delivery and improving therapeutic outcomes in bladder conditions. Intravesical drug delivery involves the direct installation of therapeutics into the bladder, providing a targeted approach for bladder-related conditions. Engineered nanoparticles offer unique opportunities to enhance intravesical drug delivery and improve treatment outcomes. Researchers have developed various nanoparticle-based formulations capable of overcoming challenges such as limited drug stability, rapid clearance, and inefficient cellular uptake. The surface characteristics of nanoparticles can be modified to enhance interactions with bladder epithelial cells, facilitating increased drug uptake and absorption. Additionally, nanoparticles can be engineered to release drugs in a controlled manner, extending drug residence time and minimizing wastage. The development of engineered nanoparticles holds immense potential in enhancing intravesical drug delivery, ensuring effective treatment for bladder conditions. Kidney stones, or renal calculi, can cause excruciating pain and compromise renal function. Nanotechnology offers novel approaches for targeted therapy against kidney stones. Nanoformulations, such as nanocrystals or nanoparticles, enable the controlled delivery of therapeutic agents directly to the site of stone formation, maximizing treatment efficacy and minimizing side effects. Nanoformulations can encapsulate drugs for prolonged release, preventing drug degradation or premature clearance. Surface modifications can enhance the targeting of nanoparticles to stone surfaces and facilitate efficient drug delivery. Furthermore, the use of imaging agents in nanoformulations enables real-time monitoring of drug localization and stone dissolution. Nanoformulations represent a promising strategy for targeted therapy against kidney stones, revolutionizing the treatment landscape and improving patient outcomes. Prostate cancer is a significant health concern worldwide, and improvements in imaging and targeted therapy are needed. Nanomaterials play a pivotal role in enhancing imaging capabilities and therapeutic outcomes in prostate cancer patients. Nano-sized contrast agents with high imaging efficiency and specificity can aid in early detection, accurate staging, and targeted biopsy of prostate tumors. Nanoparticles can also deliver therapeutic agents, such as chemotherapeutics or gene-based therapies, directly to prostate cancer cells, while minimizing damage to healthy tissues. Furthermore, the multifunctional nature of nanomaterials enables simultaneous imaging and therapy, facilitating personalized medicine approaches and improving patient care. Nanomaterials hold tremendous potential as diagnostic and therapeutic tools in prostate cancer management. The non-invasive detection of urine biomarkers can revolutionize diagnostics and monitoring in various urinary tract-related conditions. Nanotechnology-enabled approaches have the potential to unlock new avenues for the sensitive and specific detection of urinary biomarkers. Nanosensors, coated with specific receptors or antibodies, can selectively bind to biomarkers and generate signals that can be detected and quantified. Nanoparticles can also be employed as carriers to enhance biomarker stability and facilitate their detection in urine samples. Additionally, the integration of nanoelectronics and nanomaterials into wearable devices or point-of-care diagnostics can facilitate rapid and user-friendly analysis of urinary biomarkers. The application of nanotechnology in urine biomarker detection promises advancements in early diagnosis, monitoring disease progression, and guiding therapeutic interventions. Chronic kidney disease, CKD, represents a growing public health concern, and innovative therapeutic strategies are requisite to mitigate its progression. Nanoscale drug delivery systems present a paradigm shift in the management of CKD. These systems enable the targeted and controlled delivery of therapeutics, minimizing systemic exposure and reducing off-target effects. Engineered nanoparticles can encapsulate drugs with poor solubility or stability, improving their pharmacokinetic properties. Furthermore, stimuli-responsive nanotechnologies can facilitate drug release in response to specific disease-related signals, maximizing treatment efficacy. Additionally, nanomaterials can be tuned to selectively interact with diseased tissues or cells, promoting renal regeneration and functional recovery. Nanoscale drug delivery systems hold immense promise for transforming the treatment landscape of CKD and improving patient outcomes. The urothelial barrier plays a critical role in maintaining the integrity and function of the urinary tract. However, it also presents a significant challenge in terms of drug delivery to the underlying tissues. Overcoming this physiological barrier is essential for effective drug penetration and therapeutic intervention. Researchers have devised various strategies to enhance drug penetration across the urothelial barrier. These include the use of permeation enhancers, nanocarriers capable of crossing epithelial barriers, and nanostructured materials with specific surface properties. By developing innovative approaches to bypass or modify the urothelial barrier, researchers aim to optimize drug delivery and improve treatment outcomes for a wide range of urinary tract conditions. In conclusion, medical nanotechnology is revolutionizing drug delivery to the urinary tract, offering unprecedented precision, efficacy, and safety. The 12 specialized topics explored here shed light on the incredible advancements in nanoscale drug delivery systems, illustrating their potential to transform the treatment landscape for bladder cancer, urinary tract infections, kidney stones, prostate cancer, chronic kidney disease, and many other conditions. Designing multifunctional nanocarriers, leveraging nanoparticles in bladder cancer treatment, overcoming mucus barriers, employing intravaginal nanosystems, and utilizing stimuli-responsive nanogels are just a few of the exciting breakthroughs exemplified. Moreover, the development of engineered nanoparticles, nanoformulations, nanomaterials for imaging and therapy, and nanotechnology-enabled approaches for non-invasive urine biomarker detection are opening new frontiers in urinary tract therapeutics. By enhancing drug penetration across the urothelial barrier and utilizing nanoscale drug delivery systems, we can optimize treatment efficacy, minimize systemic side effects, and improve patient outcomes. The future of medical nanotechnology holds immense promise, and through continued research and technological advancements, we can further revolutionize drug delivery to the urinary tract, benefiting countless individuals worldwide.